So very warm good morning to each one of you. This is Dr. Sumant Kulshrestha from IAP Digital Media team. Today we have a webinar from IAP Goa, Women's Cell, and we have the moderator, Dr. Mamta Karpe. And along with that, we have our panelists as Dr. Gauri, Dr. Rashmi, and Dr. Parul. I request all the participants, please put in your queries, doubts in the chat box. We are also live on YouTube IAP India channel. If you have any query, anything, please feel free to put it on chat box and it would be taken towards the end. And now over to the moderator for today's webinar, Dr. Mamta Karpe. Over to you, Dr. Mamta.
Thank you, Dr. Sumant. Thank you, Dr. Sumant. Hello and good morning, everyone. I am Dr. Mamta Karpe, and I feel thrilled to welcome you all to this webinar today that's organized by IAP Women's Council, Goa. All kids misbehave sometimes. Some may have temporary behavioral problems, and some may present a pattern of hostile, aggressive, or disruptive behavior for more than 6 months. It is crucial to identify and address these problems. However, severity may decrease through special education and treatment. I guess there's a little bit of disturbance.
Requesting attendees to please mute.
Okay. So all kids misbehave sometimes. Some of them have temporary behavioral problems, and some may present a pattern of hostile, aggressive, or disruptive behavior for more than 6 months. It is crucial for us to identify and address these problems. However, the severity may decrease through special education and treatment. That brings me to today's topic, which is our third installment in our series that is behavioral issues in children with special needs. To summarize, we had Dr. Aparna Wadkar, who is a developmental and behavioral pediatrician, and she emphasized on the assessment, differential diagnosis, and management of children with special needs. Then we had a webinar with Ms. Tanvi Tanna and Ms. Dhara Bangera, wherein we discussed about the behavioral issues faced by children and the challenges faced while managing such children. Our today's speaker is Dr. Gauri Kamat Wagh, working as a developmental therapist and practicing NDT, that is neurodevelopmental therapy, and SI, that is sensory integration, since 9 years. She has done her master's in pediatric physiotherapy from Rajiv Gandhi University of Health Sciences. She has been certified by Neurodevelopmental Treatment Association, which is NDTA, based in USA, as a neurodevelopmental therapist in treatment of children with neuromotor disorders in 2014. Her article on personal experience of neonatal intervention using neurodevelopmental therapy and sensory integration was published in NDTA Journal Network in 2016. She has undertaken training in handling high risk infants using sensory integration, performing aquatic rehabilitation using NDT, therapeutic taping, and instrument assisted soft tissue mobilization. She is working as a pediatric physiotherapist at the Lokavishwas Pratishthan's special school based in Ponda, Goa, since the past 6 years. So, without further ado, I would urge Dr. Gauri to take over and share with us her experience and expertise.
Thank you, Dr. Mamta, for such a lovely introduction. A very good morning to all the panelists, attendees that are present for the webinar. First of all, I would like to thank IAPWC Goa team and Central Committee of IAP for giving me this opportunity to present before you this particular topic. I hope it would be an interactive session. And since we have attendees of different group, it is a mixed group with caregivers, parents, professionals dealing with children with special needs. I would make it very simple because we need to understand the issue in detail in order to intervene it. Okay, so after we have finished the session, you can ask your doubts and queries. I would be happy to help you. So, to begin with, we need to understand what is behavior. Okay, what is behavior the outcome of? Okay, so behavior is the action or response that is shown by an individual or child in conjunction with themselves or the environment. Okay, so when a child interacts with their system within, okay, the body system, the body parts, and the environment around them, it is the adaptive response that I would term as is seen as a behavior. Okay, it is the reaction of a child to anything in response, okay, to any external stimuli or stimuli that are coming from within. Okay, so we need to understand why a child is behaving in this particular way. So can you see this picture that child's behavior is like an iceberg. Okay, whatever behavior or the behavioral issues that we see, it may be tantrums or nail biting, pulling of hair, or screaming continuously in crowded places. It may just be like a tip of an iceberg. Okay, its causes, or whatever is happening with the child internally, or irregulation with the surroundings, the environment of the child, may be a lot of things going on with the child. Okay, the cause may be really big. Okay, there may be many causes that are leading to this particular behavior of the child. So knowing that particular root cause is very important. Okay, so we need to understand why the child is behaving in this particular way in order to intervene. Okay, so as we see, we have the behavior is like it is integrated response of many stimuli. Okay, internally or externally. Okay, whatever inputs the child is getting from within. Okay, now to begin with, I would introduce you to the systems. Okay, we all know the five senses that are there, that are seen by us: the vision, the auditory system, hearing, the touch, okay, the smell, and the taste. Okay, these five systems we are all aware about. Okay, we all sense stimuli from our environment through all the senses, and there are also systems within us, okay, which lets us know about our own body. Okay, what we call as body image. Okay, we are aware of our own body. So when I'm talking to you also, I know how I have kept my legs, how my hands are moving. Okay, because I don't have to look at them necessarily. So I am getting sense from within, which is joint position sense, we call as proprioception, or movement sense. Okay, whenever we are traveling, our internal body system called as vestibular system is organizing us. Okay, getting us used to the movement. Okay, when we stop, our body, okay, automatically adjusts to the movement. It is called as movement sense. Okay, all the systems are within us, and which drives us, okay, to get, we are getting inner drive to do particular action. Okay, and along with the external stimuli, we coordinate to get an adaptive response, which is seen as a behavior. Okay, so it may be internal or external behavior. It may be conscious or subconscious. The child may be consciously doing it, maybe to gain somebody's attention because they are not getting enough attention to at home. So gaining attention of parents, the child may be purposefully doing it, or the child may be unconsciously doing it. For example, teeth grinding, okay, flapping of hands, that the child internally seeking some sort of movement in order to regulate himself, in order to organize himself in the environment. Okay, it may be voluntary. Again, as I said, the child may be trying to gain somebody's attention, so that he's been given attention, his needs are being addressed. Okay, with children with special needs, the major problem is communication. Okay, they may be non-verbal, they are not able to communicate what their needs are because their speech is not developed, or they may be just indicating whatever they want, like just pointing out to things. Or the higher children with higher functioning, they may be not able to put up sentences well in order to tell their needs. Okay, so it is very difficult for us caregivers and professionals to understand what the child is undergoing. Okay, what is it that child wants at that particular moment, whether it is hunger, or whether it is the child is not okay with the environment, he wants to go somewhere else. Okay, maybe the basic needs that the child wants at that particular moment, we are not able to understand because there is communication lag between us. Okay, it may be overt behavior or covert. So overt may be the aggression, the tantrums that are seen by us, and covert maybe there are, the child may be in a shell, we may not be able to understand what behavioral issues the child is undergoing, that only surface after a while when it comes out as an aggression or tantrum, or we see nail biting, or self mutilating behaviors like biting self or pulling hair. Okay, so it may be the behavioral issues may be seen as different variety of issues in a child. Now we need to know the theory. Okay, when we know the basis of it, it becomes very easier for us to understand, the when we know the cause, it's easier for us to find a solution for the problem. So it is proved that the research evidence based practice shows that it is our brain that controls everything. So whenever there is even minimal brain damage, okay, which may be caused due to impairments in system during birth, or later on when the child is growing till 5 years of age, the wiring, okay, our main controller is the brain, and there are wires that supplies all the systems in our body, okay, which helps us get the stimuli from all the systems, all the organs. The brain integrates them and then shows as a behavioral response, okay, or an action or response to whatever stimuli we are getting from the environment. So if there is any particular brain damage or minimal brain damage that is seen, maybe because the oxygen supply was not proper, the child had some medical condition or fits, seizures that we call during the during the child's birth, or prenatal period when the child was growing. Okay, because all the sensory development, okay, organs of senses develop right from the child is being forming in the womb of a child. Okay, the child forms connection with the mother, okay, through tactile sense. Okay, the child gets a cozy warm environment when the child is growing, and he gets feedback from the walls of the mother. So his touch sense develops, we call it as tactile sense. Okay, tactile sensory system develops. Then there's a very feeble light in the environment there. Okay, so vision is not very much developed, but he's used to very calm surroundings with light, very dim light. Then the child can hear mother's voices. So all this sensory development is occurring in the womb. Okay, right from the child is developing in the womb. So if there is premature birth, the child comes out in the world much before the 36 weeks of gestation, then all the sensory development has not occurred. And when the child is in NICU, there are beeping sound of the instruments. The light is very bright, continuously the professionals are intervening with the child. So it is very much overwhelming for the child. First of all, the sensory organs have not developed, and too much of sensory stimulation is there, which the child cannot take. So all these experiences that the child is having right from the birth, all the child that the child is having right from the birth affects the development of the child later on. Okay, which is shown as some sort of impairment in the behavior. Okay, so when we see say more complex the CNS, more the child shows better behavior, better learning of skills, okay, better developmental outcome. Now we will see when a behavior is regarded as a problem. Okay, so certain behaviors the child does are to regulate themselves. Okay, because they are not getting enough senses from the environment. Okay, children with special needs may have impairment in some or the other system. For example, they are not getting information from tactile system. Okay, they are not getting senses from through their touch. So they will keep on fidgeting with something. They will like touching different surfaces. They will like playing with their hair or nail biting. All these things they do in order to calm themselves because they are not getting enough sensory input from their systems. Okay, so we need to understand whether this behavior is causing problem in their development or it is okay. Okay, or we can allow the child to do it, or maybe because the child is remaining alert with these particular behaviors and the child is able to pay attention to our commands or whatever we are trying to teach the child. So we need to understand when these behavioral difficulties become a problematic in the society, or which causes developmental delays in the child. Okay, it shouldn't be socially causing disturbance. It shouldn't be causing the child to have communication lag with their peers. Okay, if the child is continuously hitting, okay, biting other people, other peers group, then of course the child may not be accepted in the society, in their own classes. So it is very important to understand when a behavior becomes a problem. Okay, if it is a problematic, then only we would intervene it. Or even if there are behaviors that are that the child is continuously doing, okay, like stereotypic behaviors, the child is continuously looking at the moving fingers and he is not paying attention, then we would intervene it. We would slowly give stimuli that would reduce the behavior and cause the child to do a more directed action oriented behavior. Okay, so in order to understand this, we need to look at the cause of the behavior. Okay, so why we have to, to find out cause, it is not very simple. Okay, but we need to understand the problem very well. Okay, so get the details of the problem first. As a caregiver or parent, it is our responsibility. Okay, because whenever you're going to a professional, you need to tell all the details of the behavioral issues that you are facing. Okay, because you need to know what is that particular behavior. Okay, why the child is doing that. So in order to know that, we have to find out what is the frequency of the behavior the child is showing. When the child is particularly showing that behavior, is it some kind of stimuli or some sort of a person towards whom he is showing that particular behavior, or it is when the child is hungry, or during a particular day of time he is showing, when he's tired and he's getting sleep but he's not able to sleep, he's showing that particular behavior. So note down the time of the day when he is showing, how many times does the child show behavior. Okay, when, where does the child show behavior. Okay, and how does the child stop this particular behavior. So is the child doing something that stops the behavior. For example, he loves to suck his thumb and that is what calms him down, or he continuously cries and then sleeps off. Okay, or it is something which after listening to auditory or some music, he would calm down. So note down how he regulates himself, because that we can use as a strategy to calm him down. Okay, so it is very important that we know the child very well. Okay, why, what are the likes of the child, what he does not like. Okay, and note down all this, because it will be better for you when you approach a professional. Okay, how does the child see everyday world. So like I said, every child is different. They may have different impairments in various systems. Okay, whether I mentioned like vision, auditory, tactile, okay, all the systems, they may have different impairments. So even if the child is two different child we have with sensory processing disorders or autism spectrum disorders, they may not show exactly same features. every child is having different type of behavior, and we have to be very specifically dealing with it. So I would summarize that behavior is a result of sensory integration. When we get the sensory inputs from within us or externally from the environment, the brain processes and shows out as a behavior. Okay, as an adaptive response, the behavior is seen. So we need to see that this particular wiring right from the external environment to within us is appropriate. Okay, so in sensory integration is all about the information processing that the brain does. Brain selects the input from the environment, it enhances whatever has to be done or inhibits which are not necessary for us. So right now we see there are a lot of background noises also happening. Okay, we are attentive towards it, but we are just filtering them out. So our brain is processing lot of things at one single moment. Okay, there is sound of the fan, somebody else in a family member is doing something, calling out to us, but we are focused at attention because we are interested in this particular action. Okay, so brain does a lot of multi sensory organization at one particular time. Okay, then it compares, like for example, we get smell of some exotic dish, we associate it with our mother cooking at home, or before what it must be this particular dish which we have already tried. We are able to understand that what smell it is. Okay, so we are associating with our past memories. So that is all the brain does. Okay, and how it associates in a flexible environment. Our environment is constantly changing. For example, we are just walking on a road, we are continuously getting stimulus from so many things at a time. We have to dodge vehicles, we have to be aware of the horns, we have to integrate so many senses at one time. So our brain is really complex, doing lot of functions at time. So if there is any particular part which is not functioning because of any cause during birth, all this processing of information becomes problematic for us, and we may not be able to show behavior in a right way. So CNS has plasticity. It has very good characteristics of brain and other nervous system, the central nervous system, that it can rewire. Okay, if there is any uh, part is affected, then there are other parts of the brain which can take over the function if we give appropriate stimuli. Okay, that is what causes the becomes the base of our sensory integration therapy, because with the right input, appropriate input, we can get very good adaptive response from the child. The behavior we can make appropriate. So it occurs in a developmental sequence. We would see the developmental sequence of sensory later on. So it becomes very easier for us to integrate, okay, intervene a child, because we can progress in a developmental sequence of sensory systems. Then brain functions as a whole. I said brain is the main controller, and it gets inputs from all the systems. And behavioral once there's an adaptive behavior, okay, or we have inner drive. If a child likes something, okay, if the child is watching something, he gets inner drive to approach that toy. Okay, and once the child has approached, he can sense it, he gets again information from that particular toy, which is coordinated by our brain. It integrates in the adaptive response, again leads to another adaptive response that we learn as we integrate all the processes from the environment, and the whole thing is done by our brain. Okay, so inner drive is necessary in order to participate in sensory motor activities. Okay, we need to have inner motivation. Okay, see, it is like vice versa. Okay, when we see something, we would want to approach it, or if when we feel something, we would want to approach it, and then we would know what it is. So we are learning in the continuous process. We need to have inner drive, motivation in order to do something, and when we do that particular activity, our brain learns more about that particular activity. So we have lot of sensory integration happening in our daily life, as I mentioned to you. When we are doing one particular activity, there are many senses integrating, at one time. So with children, their play, their self care, okay, all this, has sensory integration in it. It is very important that all their sensory systems integrate together in order for them to play normally, or show a development like typical children, show a proper organized behavior. Okay, so it helps, the sensory integration helps us to interact with the environment, okay, to have sense of self. Okay, who am I, what can I do? The children know about their own body, and their position with the environment around them. Okay, organization of behavior in time and space, it helps us to do organize that. Okay, then developing skills and abilities. Okay, so when sensory integration is happening, we are learning new skills and abilities, okay, according to our development. Then self regulations of emotions, then our attention, arousal, alertness in the environment is helped with sensory integration in daily life. It helps in goal directed action. So our, when we are performing in a typical way, our actions are goal directed. We want something and we are trying to behave in a right way to get that particular thing. So these are goal directed actions. Okay, so meaningful activities we are doing, and children with special needs often do behave in an atypical way. So they are, going away from goal directed actions. They do lot of destructive activities, throwing activities, which is not meaningful for them. So we have to, with the help of different sensory systems, we can teach meaningful activities to them. Okay, then sensory information is actually nourishment for successful performance of any action. Okay, if we are giving them appropriate sensory feedback, then it is, we are getting the right adaptive behavior. Then I mentioned to you what are the level of sensations are, what are the systems that are coming from within. So one is vestibular. I mentioned to you, those are internal systems, vestibular, proprioception, and external are vision, hearing, okay, smell, touch, taste. All these senses, of course, we are aware of. So our children are gathering information from all the systems in order to show an organized behavior. So I mentioned to you developmental sequence of sensory organs and sensory development. How does it occur? So all these are first of all factors which are affecting it. The genes, okay, what we exhibit from our parents, from our family, then the experiences that we get from the environment. If two twins are, one is brought up in an economically poor environment, or and other one is kept in very rich environment where everything has been given to the child, okay, the behavior that is shown by the two twins, okay, will be completely different. So influence of environment is very important on our upbringing, the development of our sensory system and overall development. Okay, interactions with system, okay, if our all the systems are intact, they do not have any problem, we get sensory input in a right way. Okay, then sensory nourishment, okay, how much sensory stimuli we are getting, how much exposure we are getting to the senses is very important. Okay, if we are not given enough senses, we are not exposed, we are only kept in a like a shell, we are not able to get out of the house, we are not exposed to our peer group, we are not able to interact with them, of course there is sensory deprivation and our growth will not happen. So right amount of sensory nourishment in all aspects is important for appropriate behavior to be seen. Overstimulation is also not right. I mentioned to you how child, when their systems are not developed, how overstimulation also causes a disturbance in the behavior later on. Okay, so overstimulation of sensory stimuli is also not appropriate. And adaptive response, of course, adaptive response or goal directed action is what we look at in order to find out our further intervention or progress of sensory integration. Now, typical sensory development occurs as at prenatal period, when the child is in the womb. uh, we are getting the sensory development, the development of the sensory organs happen. Okay, our sense, vision, the tactile system, I told you, it is developing when the child is inside the mother's womb. Then from the birth to 1 year of age, okay, interoception, that is the stimuli from within predominates, they are more. The child needs to get inner drive in order to do particular action. The child is learning from the environment. The child is getting senses from their joint position, their body image. From within, they are getting drive in order to do very small actions, maybe just approaching a toy, rolling over. The child is getting senses from within them. Okay, from 1 year, in a toddler stage, the child is developing senses from within. Okay,
Dr. Gauri?
yes.
Dr. Gauri, can you hear us?
Yes, yes.
Yes. So there was a slight lag. So please repeat the last sentence, please.
Okay. So when I said interoception, that is the stimuli from within are predominating. That is from birth to 1 year of age. So children are learning through sensory inputs from within, because they are getting information from their joint position of their own body. Okay, they are learning when the drive is from within. Okay, they are when so for simple approaching a particular toy, they should like it, they should get inner motivation drive in order to approach a toy. So simple things are learned because their senses from within are predominating. Then in toddlerhood, when the child is from 1 year to 3 years of age, when the child is walking, okay, learning few steps like hopping or galloping, the child is moving. The child is getting senses from the environment because they are moving, they are understanding their body in relation to the space around them. They can coordinate time and space, okay, going underneath, get manipulating their body in order to reach a toy. Okay, they can get relation of their body with the environment. So that is how they are developing sensory. Then when it is the period of 3 to 7 years of age, the child is learning praxis. So what is praxis? So having an idea about movement or action and doing it. Okay, doing coordinating with our whole body in order to do an action. Okay, so for example, I have to, there is a the doorbell rings, I have to go and open the door. So first I have to get up from the chair, I have to adjust my body around the environment to tackle the obstacles whatever they are there in the way. I have to open the door. There are many steps involved, so I have to motorically plan my body actions in order to do that particular action. So the child learns all these things. The child is having idea of action and the child is doing it. Okay, and then later on, the child after 7 years of age, it is very easy for the child to regulate themselves. Okay, to regulate their emotions, to regulate their alertness in the environment, their arousal. Okay, and interact very well with the environment. So that is how the development of sensory systems happen. So we have to understand this process, because in order to understand the behavior issue, the root cause of it, okay, we have to understand what all stages are involved in this information processing in order to get an adaptive behavior. So what is registration? Registration is all about awareness of input. Okay, for example, we are taking visual system, just able to see the stimuli is registration. Are we aware of that input? When it comes to auditory, are we hearing the sense? Okay, are we hearing the auditory input? Okay, are we registering the particular stimuli? Okay, whether our child can register or not register. So our organs are intact and the wiring from the organ to the brain is intact or no, we have to check. Okay, so whether the child is registering that particular stimuli or not. Okay, so it is very important to differentiate and discriminate. Okay, now for example, when we take touch sensation, we understand the texture of it, whether it is slimy or whether it is soft, whether it is rough. We understand many things when we, when we see, we understand the color of an object. We see whether it is small or big. We understand the texture of the object. Many things are, being registered by our organs. So it is very important step in the sensory processing, the registration. So now there is habituation and sensitization in this. So from the picture you can understand. Are you able to see the picture or this is coming in way?
It's fine, doctor. Thank you.
It's fine, right? Okay. So, when there is over responsivity, okay, the child will be, not wanting to get the stimuli. He will be just running away. He will be defensive to the stimuli. And when the child is not getting enough information, the child will be seeking it. The child will want to get more of the stimuli. Okay, the child will be seeking it. Okay, or there is a stage when the child is not getting enough sensory stimuli from the environment and he is yet very passive. Okay, so he does not even want to get more stimuli from the environment. He is just cut off completely from the environment. So two types of behavior are seen in the children, whether they are seeking the stimulus or they are avoiding the stimulus because the stimulus that they are getting from the environment is too much for them. Okay, so sensitization occurs when the intense reaction or over or defensiveness that we see. Okay, the child gets habituated with the stimuli and it becomes too much for them. Okay, and habituation occurs when the sensory stimulus is given again and again and again and they are no more responding towards it. Okay, so in both the situation you do not get an appropriate behavioral outcome. So next in the process is the filtration. Okay, so now filtration, I told you, when we are doing a particular activity, we have to cut down the background, everything, background noises, background stimulation of visuals, stimuli. Okay, when I'm looking at a particular person, I have to ignore everything, all shiny objects, all moving objects that are there around. With our kids, okay, with kids with special needs, what happens is cutting all this other sensory stimuli is very difficult for them. Everything is coming at once. They are very distractible. Okay, they are paying attention to shiny objects, moving objects. Everything is whatever is happening at that particular moment in the environment. So filtration is very important step to in order to go to further. Okay, modulation is, as I said, the brain enhances or inhibits the sensory stimuli in order to get the appropriate stimuli to the brain. Okay, whether it is coming too much, we are we adjust so that it has to be appropriately gone to the brain, or whether it is less that is coming the stimuli, we would automatically go towards it. Okay, for example, when we take auditory system, if the noise of the phone is very less, we would increase the volume or we would hold it close to our ear. So that is how we are modulating, our behaviors are modulating in response to the environment. Okay, so in modulation also you will see behaviors in order to see what we are doing ultimately is our arousal should be optimum in order to interact with the environment. Okay, so we have to modulate because we have to get just right level of input from our environment. So we have to, when we look at our children, we have to pay attention to these four things, okay, which is very important. First is arousal, okay, how the child is in the environment, okay, whether he is too much aroused, it is too much alert, okay, it is anxious, crying, or the child is just appropriately interacting with the environment. He's able to get the input whatever you're giving, he's rightly alert in the environment, or the child is very drowsy, very lousy, not able to get. You have to continuously talk to the child, or continuously give some stimulus in order to wake up the child. So that's when the arousal level is low in that particular child. So we have to know the arousal first. Attention, whether the child is giving attention to that particular task, okay, how is the child, how is whether he is giving focusing the attention, or he is very much distractible with the other stimuli. Then affect is emotional state of the child, whether the child is appropriately responding, whether the child is liking the smile that you see when the child sees something that he likes, or when the child does not when the child does not like something or dislike something, he would just go away from it, or try to just stop that and goes to something else. So you have to note down very small things, how a child is responding emotionally to any particular thing, or a child is suddenly laughing, suddenly suddenly crying, or the child is very emotionally labile, cries very soon. So all this you need to note down and give input to the affect of the child. And action is the adaptive response, whether it is goal directed behavior that you see, or it is just disorganized. The child is not able to play age appropriately. It is the play of the child is not completely organized. It is just the child only throws off. The child is not understanding basic things like putting in or putting out, where the play of the child is not appropriate according to the age. Then that would be take noted in the action of the child. Okay, so modulation is the ability of the child to modify the behavior according to the inputs from the environment. So next step in sensory integration is processing. The brain processes all this information to give the last step, that is adaptive behavior. Okay, whether the response, when we get stimulus from all these systems appropriately, the brain processes appropriately, then only we would get a good behavior, or behavioral issue. So now we need to understand, I told you that's already engine levels. Okay, so we have to see, sometimes we feel just right, okay, we are able to do all our whatever we have decided today we would do, this particular work, that particular work, we are just in right conjunction with our environment, and we are able to do all the activities, we are very happy at that moment. Okay, so our engine level is running just right. Or sometimes it is too high, we are restless, we are anxious. Okay, it happens with every one of us. Okay, even typically developing children will go through all these engine levels. Okay, and or we are too low, that we are too lazy today, the maybe the climate is affecting our behavioral outcome, we do not want to do anything today, so we are at a very low energy levels. This we need to understand when uh, what your child is at which particular engine level. Okay, whether the child is here it is shown as blue. Okay, the child is sick, sad, tired, bored. Okay, moving very slowly, so he is having a low engine level. Green when he's happy, calm, okay, focused, ready to learn something. Okay, or the child is showing some alertness signs, like the child is frustrated, anxious. Okay, he's too excited about something. Okay, not appropriate at that particular stimulus for that particular task. The energy that the child is showing is too much, or it is red. Okay, the child is completely mad. Okay, getting aggressive, torturing his own self, or harming others, pulling his hair, biting himself. Okay, so learn to understand in which particular zone the child is. Okay, so we have to get them to the just right level. Okay, whether the child is too low, we have to give input which are alerting, arousing for the child to get into just right zone. And if he's too anxious, too much crying, we have to give them a calming down input in order to get to just right zone. So now common behavioral discrepancies that we see. Okay, the behavior that are seen more associated with the tactile system. Maybe the child is very much hyper irritable with handling. That is when the child is defensive. He does not like touch sensation. He may prefer only particular type of clothing. So I want, uh, only soft material. I do not like any other material. The child will cry when you try to put him woolen clothes or any rough material. The child hits himself, bangs himself, because he's not probably getting enough just right sense from his tactile sense, that is the touch sense. Okay, the child may have feeding difficulties, so only certain type of textures the child is preferring. He does not like slimy, he likes only crunchy, only chakri he will like. So certain feeding preferences the child will show. Then difficulty adjusting in crowd. He does not like people overcrowding him. Too many crowd. He will always avoid crowd. Okay, he will run away from when there are a lot of people around. So these are discrepancies or behavioral issues that are seen related to the tactile system. Then he cries when you wash his hair or clip their nails. Okay, all these are defensive type of behaviors that are seen. Then strong preferences to certain smells. So child will keep on smelling certain smells. Okay, if a particular person is smelling good, he may continuously go and smell, which may not be accepted by the unknown person, but that is what the child is doing because he is liking that smell, and he's not getting enough sense, enough information. He wants that smell, so he's going and smelling that particular person. So all these are behaviors that are seen related to the tactile system. Then we see proprioceptive discrepancies. Okay, what are the behavioral issues that are related to the proprioceptive system? Proprioceptive system is the sense that is within us. Okay, it is about our joint position sense and about our body image, body schema. So children, maybe this children particularly will be labeled as aggressive. Okay, they like rough play, they like pushing people, they like wrestling games. Okay, playing very rough play. Okay, they love banging their heads or legs, stomping while walking. Okay, they break toys easily. They are not able to grade while writing. Okay, they may write with lot of pressure, or they may write very lightly. Okay, so note down this signs. Okay, they may not be interfering with the behavior. Okay, but all these are signs which shows that the child is having discrepancy in the proprioceptive system. Then they fall frequently intentionally on the floor because they want internal joint position sense. They want to feel the external environment. They want to feel the pushing sense inside their body. Okay, they grind teeth. Okay, they continuously make that grinding sound. That is because they want more proprioceptive input in their the joints. Okay, we call it the temporomandibular joints. They want continuous sense in their environment. The inner sense proprioception is seeking the external world. Then vestibular discrepancies. The child maybe is continuously on the go. He loves running, jumping from a height. Okay, which is very risky play. Okay, the child loves running, jumping from anywhere. He continuously loves spinning. Okay, so all these discrepancies are seen when the child is having vestibular system problem, or when the child is over responsive to this vestibular. The child will be avoiding the movement. He does not like going in escalators, or going for a drive in even moving car. He will not like. He will be terrified of fall. He will be terrified of heights. Okay, all this seen when there is discrepancy in the vestibular system. Then the child will spin for hours. He will be always on the go, running. He will not be sitting at one place in order to pay attention to you or listen to your command. Okay, then next we see is auditory discrepancies. Okay, the child often loves to make sound from external world. Okay, the child, whatever the child will take a toy, he will like love to bang it and to make the noise, because he wants that particular auditory input, because he's not getting enough input from the environment. He likes to continuously self talk. Okay, talking continuously and not paying attention to other commands is also because the child wants auditory stimuli all the time. Okay, then poor listening skills, the child is not obeying your command, is not listening to what you're saying, because there is some discrepancy in the auditory system. Then the child is cranky in public places. There's, when he's going out, the horns of the vehicles, the people continuously talking, it is too much overwhelming for the child. And there is auditory filtration difficulty, so the child is not getting appropriate just right input from the auditory system, which is giving an aversive response. Okay, aversive aggressive behavior from the child. Then again we have visual discrepancies. In You will see that children often loves to watch moving objects, or just look at their fingers while moving, or take one object and continuously run across, because they love getting visual input. Okay, so all these behaviors are related to the visual system discrepancy. They love looking at shiny objects, running, moving objects. Okay, difficulty finding objects in clutter, when they are having visual, when they cannot discriminate one object from another in a cluttered drawer. There may be visual discrepancy. Then while getting down from the steps, the child may have depth perception issues. That is why the child is fearful. Okay, so we have to understand where the behavior is coming from. It may be from one system or another. One system is influencing the other system. Okay, or it is many systems together which are causing that particular behavior. So now intervention, I would be telling you in general, because intervention has to be very specific to a particular child. It cannot be in general. Okay, it has to be tailor made. Okay, like how we stitch our clothes according to our body size, it has to be according to the needs of the child, what the child likes, dislikes, according to the evaluation that you get. Okay, so when you will go to a professional, the professional would do complete assessment of the child, get history from you, take his daily routine. Okay, what the schedule is, how the sleep wake cycles are, what the child likes while eating preferences, clothing preferences, then how the play of the child is. Okay, everything is been taken. Then we have caregivers questionnaire. Then there is sensory profile, okay, which is according to the age group, because certain sensory behaviors are very typical at that particular age. For example, child who is 6 months or 8 months of age loves to put everything in the mouth. Okay, because they are exploring through the taste, the mouthing, they are getting information through their oral system. Okay, which may not be typical with the child who is of 5 or 7 years of age, because the child should understand what it is. The child is not exploring by mouthing at that particular age. Okay, so sensory profile is also devised according to age group. So there is 0 to 6 months sensory profile, 6 to 12 months. Then there is 12 months to 3 years, 3 to 4 years. Okay, 4 years and above. So like that the sensory profile is devised, so that we understand if there is any discrepancy in the sensory input. So there will be questions like, does the child like having bath, does the child prefer certain clothing, does the child cries when nails are clipped, does the child love watching at spinning objects. All these questions are there in sensory profile according to the child's age group. Okay, so it is very important that a complete evaluation is done, and then the professional would prioritize in which particular system the child is having a problem, which system it is which is causing the behavior to occur. Okay, and then a home program or systematic sensory intervention can be given in order to get the child calm down, or just in the just right engine level, alertness level. Okay, so these are just general guidelines that you need to know. Just wait for the child to respond. Whenever we say it is sensory integration, we have to see that the child is actively responding. Okay, he's actively participating. We are not forcing anything on the child. It shouldn't be like whatever we want we are imposing on the child. The child should be able to participate on his own. Okay, it should be a child directed sensory intervention. Okay, the child should respond and love whatever you're presenting to him. Okay, whatever stimuli you're presenting, the child should accept it. That is when you will get a proper adaptive response. Okay, do not overwhelm, do not give lot of stimuli to the child. Okay, just learn what is the problem of the child and give stimulus to the child one at a time. Okay, work in a calm environment so that the child is not very much distractible. Work in a dim light, okay, where there is less noise, less light. Okay, when so you will get a better response from the child, better attention from the child. Okay, deep pressure is always safe to work with. They love calming input. So hugging them, okay, and then showing them a particular task, or just working with very simple thing, just you taking something and putting in. Okay, it depends completely on the level of the child, what you want the child to do. But it is always good to give a calming response, but which is to get a connection with the particular child. Okay, then respect child's fears. Okay, because the child does not like movement, do not put the child directly on the swing and sway the child. You have to understand what the child does not like. Okay, because then you will not develop a connection with the child. Know what the child likes and what the child does not like. So you cannot directly barge into the child's space. Okay, develop a repo. Okay, when the child is playing, you then go and intervene in his world. The child will not accept you. Okay, only when you're a parent or caregiver, the child may be used to you, but when you're a professional, you need to know that it has to go in a very smooth way. Okay, then always work for an organized goal directed behavior. Okay, so whatever you're looking at, see to it that the child is learning something, some very simple skill, maybe just holding some toy and putting it in a basket. Okay, that, or and also see to it that after you have shown any particular task, you keep all the toys in place so that the child knows that this is organization. At the end of everything, you have to keep in place. Okay, so that will also give a discipline, a good behavior in a child. Okay, so you have to watch out always. When you overstimulate a child, give lot of sensory stimuli, the child may go into shutdown. So shutdown is the time when the child just sleeps off, and that time you cannot intervene more with the child. The child will not respond to any of your stimuli. Okay, the ANS responses, autonomic nervous system responses, like fear in a child, okay, continuously crying, you have to be very careful while working with the child on a swing. Okay, giving a movement which the child is not used to. Okay, so whenever you're giving a sensory input which the child has not experienced earlier, you have to be very careful. Okay, then ultimately you have to see the motivation of the child is increased. The child is showing interest in whatever activity you're taking. The child vocalizes, okay, says something. Okay, child gives eye contact. Okay, that is when the child will start interacting with the environment, the people around them. Okay, increase the general alertness, interaction with the environment. Okay, then how to progress. Okay, the play should not be stagnated. You cannot take the same activity every single day with the child. Okay, the child will get bored of it, and and he will not respond to you at all. So you have to search for activities which are simulated, which are similar to the activity that you have done in a short period of time. Okay, it has to be related. Okay, it cannot be monotonous. You cannot take same play with the child every single day. Then slowly increase the complexity. Okay, if you're making the child sit in one place, make the child take the toys, keep in some other place. Introduce movement in the task. Okay, make increase the complexity of the task slowly, Then work on coordination of the child. If the child is bigger enough, work on bilateral coordination, okay, coordination of his body parts, okay, with each other. Then projected actions, okay, copying of actions, okay, like for example, our children have lot of discrimination. This you come to know while professional does a SIPET test, that is sensory integrated process, perception testing. Okay, so when perceptual tests are done, you come to know whether the child can mirror your actions. The child can do bilateral actions. There is proper lateralization. Other senses like tactile discrimination, localization, all these are seen by a professional. So teach them how to copy actions, okay, and coordinate between their body. So you have to teach them sequencing, motor planning. Okay, motor planning is giving an activity with verbal commands and asking the child to do it. Okay, progress with one command at a time, then give multiple commands. So you have to slowly and gradually increase the complexity of the commands. Then I would, calming inputs I mentioned to you are always proprioception, like, giving a weighted blanket, or, making the child sit in a bean bag. Okay, so whenever child is aggressive or overstimulated, it is always good to give all these calming inputs. Okay, so hugging the child and giving only linear motion. Okay, you are combining two stimuli at a time, proprioception as well as, vestibular, okay, movement also you're giving. Then giving a weighted jacket, okay, or comfortable cotton lycra, proprioceptive body suit that you get, which gives input to the child, okay, which is calming input, okay, which helps the child to work, be alert in the environment. Okay, then all this that are mentioned, you have to see how the child responds to particular stimuli, and then only you have to give slow bouncing on a ball, or just one direction, a linear motion in swing, okay, bolster, or platform swing, or a hammock swing that you can make at home, okay, just by tying a very sturdy dupatta and make the child, okay, sit in that, and okay, giving one linear motion. These are all calming inputs. Okay, then taking a break is very important with the child who is having higher function. Taking break from the task is very important. Okay, you may give them stretching activities or talking to peer, okay, or using some other tactile input, like using therapeutic or play doh, okay, bouncing on a ball for a while, just going away from the task is very important. Otherwise it becomes like a monotonous for the child. If the child is studying for a long time, the child will not give appropriate input. So taking breaks is very important in order to regulate the child. Okay, so all the sensory strategies like hugging yourself, resting in a quiet place, okay, even when the child is aggressive and he understands, you can just tell the child, okay, you are very aggressive at this moment, I will not respond to you, you can go in the quiet corner and sit over there. So these are all these strategies that you have to use in order to calm the child. If according to the level of the child, you have to devise the calming strategies. Okay, then general guidelines I would like to mention. uh, Children want attention of parents, they want time of parents. So taking out from your busy schedule and giving them some time, okay, whether it is play time, developing connection with them is very important. Okay, so give time to your kids, know your child well, then only you will be able to understand their behavior problem in a right way. Okay, and when we understand, it is easier to find a solution for the same. So modification of environment, okay, we can use when the child is non-verbal, we can make this picture communication boards. Okay, so you can just mention I need, the child would show, or you can make small placards where child wants to play, child wants a squeeze, child wants dinner at that particular time, child wants a snack. So the child would point out to those, okay, depending on the functional level of the child. Sorry, the level of the child would be able to tell what the child wants. because we saw that when the child is not able to communicate their needs, they would show a behavior which is not controllable. So when you make these changes in the while interacting with the child, it becomes easier to structure their behavior, to structure their schedule. So make this picture communication board so that the child is able to indicate their needs, what they want. Okay, I want now it is time for lunch. Okay, now it is time for dinner. You can show the placards to them. Okay, if you want to drink water, you can show this particular card, or he would take you to the drinking, to show where you get the water. Okay, it all depends on whether the child is able to tell his needs, whether what is the IQ level of the child. It will all depend on individual child. Okay, so you can help this children by using this communication boards, those who are able to indicate their needs by showing two pictures. Then taking care of own health is very important. Okay, taking care because we are completely stressed that our children are showing this particular behavior, we are not able to find a cause. Okay, we are not able to intervene them right, and we ignore our own health. But if you are mentally good, healthy, then only you will be able to give time to the child. If we are already frustrated, then it would come as a frustration on our child, and again everything would go berserk. We will not be able to find out what is the exact cause, and we would not be able to give right information intervention. And the social stories I would like to mention is children with autism spectrum disorder or sensory processing disorders. Okay, they we can always tell them what are stories. Okay, we can make small social stories that, okay, for example, this is now corona time, so we have to wash our hands very frequently. Okay, because this particular virus can be affected on our hands, that would cause difficulty for our health. Okay, it may be harmful for us. So we have to make social stories like, there's a girl who did not wash her hands and she fell ill. So we have to wash our hands in order to get this particular, I mean, we have to be healthy, we have to get good health. So we have to wash our hands frequently. So this way we have to make social stories and make the child understand the current situation. Okay, then next is structuring their routine. When they know what is coming next, it is very easy for them to understand that we have next, what particular thing is coming next. So 10 o'clock is our play time, we know. Okay, so when it is organized for them, it is very easier for them to organize their own self with the environment. Okay, if suddenly something comes to them, it may be overwhelming for them, and they may not react appropriately to it. So 10 to 12 is we know, if it is fixed, so activity with mom we have to do. Then 12 to 1 lunchtime. So all this, they know what is going to come next. So all these daily schedules you can put up on the wall, so they know what we have coming next in the schedule. So they are already prepared their mind, and they are ready for the input. Okay, so when they are more organized, it is very less likely to cause any aggressive behavior. So next is recognition and rewarding them. So always reward a good behavior instead of punishing the bad one. Okay, because they always associate a tantrum with attention of parents, and then they would always do that. Okay, when they throw a tantrum and then only you give attention to the child, then you give them whatever they want, then that particular thing is set in their mind that whenever I throw a tantrum, then only I'm being noticed. Okay, so do not do that. Reward a good behavior instead of punishing the bad one. Okay, so whenever you give punishment, they understand, okay, they are giving attention to me. Okay, I'm getting their attention, so I have to continuously do this. Okay, so how you can reward them? Okay, make behavioral charts. Okay, cheer the child. Okay, so or like this is an example, a Christmas child that is done by a parent. So the right one you can see, the when you are in a the naughty one, you have not done anything good this time, okay, so you will not get anything from Santa. Okay, your or little better level will be you are in a danger zone, you did many times naughty things which are not acceptable, or you were very good, you were nice, okay, or extra nice, you helped me, you helped your sibling, you were very good while interacting in the school, okay. So this is a cheerometer, okay, this is just an example you can do. So according to when they have siblings, it becomes very easy for them to compare their behavior with their siblings, okay. So this helps in regulating their behavior, okay. They would try to match up with their peers or match up with their siblings and try to be showing a positive behavior. Then you can always give a reward chart to them. So Monday you were very good, you did this particular activity, okay. You did on the next day you were very good, okay. If you did not do, you will not get a star. So that may be rewarding for them, okay. So you can do this reward chart so that they have a visual feedback that yes, you were good today, you will get a star, okay. So at the end of the week, okay, I he got 3 stars this week, so this next time you have to get more stars, or this week was not right, you did not behave right in a right way, you got only 2 stars this week or 1 star, okay. So then distract them whenever they are aggressive, try to divert their attention to meaningful tasks or give them a choice, okay. Something they would like to do, okay, just which should be again meaningful, okay. Give them a choice, okay, if not this, then you can do this, okay, but you have to come back to this particular task. So give them a choice. Role of family members connecting with the child is very important, okay. So if there are interparental fights, that may again affect the behavior of the child. So having a very good environment, okay, a healthy one, okay, loving one, okay, sharing responsibilities, it is very important that the child see their parents as loving, because that would affect their attitude towards them and towards their environment, towards society. So when you give good love to them, kindness, you will see kindness in them, okay, back return to you. Then they learn from siblings, okay, they learn good behaviors, tasks, okay, whatever whatever learning skill, okay, they learn pick up very fast from their siblings or peer group. So engage them with peers, okay, connecting them with their age group people is very important. Avoid violence at home, okay. Every family member is important, and they should have a knowledge of good touch and bad touch, okay. This is for the safety of the child, because the child should know what is good and a bad touch, okay. Because when the child is in teenage or puberty, the child will not understand if somebody is giving them bad touch, okay. They should be aware of their family members, what is the right touch, and where the touch should not be done, okay. They should be aware of their private parts, and what is a good touch and a bad touch, okay. Why so here the role of the family is very important. You need to tell them that taking a bath from parent is okay, but or showing their parts to their mother, or sometimes when the mother is not there, from a father it is okay, but not to any other person. So your safety of the child is very important. Now if the functional level of the child is very less, then individualized education program is required. So one-to-one session by shadow teacher or special educator is required. So you always see, the caregiver or parent should always see that whatever intervention strategies you're working at home, that are followed in the school as well, okay. Because it whatever rewarding behavior, rewarding thing that you're doing, like using stars or appreciating the child, you have to have a good communication with their teacher, so that the same thing is followed up in school. Because you sometimes see that whatever behavior issues are seen in the school, the children may not do it at home, because they are intervened in a different way at school. So your communication with the child is very important, okay. Child and their teacher is very important. So of course, see, we have to see when the behavior is out of control, when the medication is required, okay. when the child is harming himself continuously, scratching his ears so that they are bleeding, all this behavior need to be addressed with medication. Okay, the calming medication are given by developmental pediatrician. So you need to understand when this behavior can be calmed down with sensory strategies, and when you need to see a professional. Okay, so this can be the behavioral issues can be clubbed as behavioral issues or mental issues. Okay, there are other issues which are seen, which are dealing with the communication of the child. Okay, the child may be in a shell, okay, getting depressed. That is when you have to seek help of behavioral counselor. Okay, the behavioral counselor will guide you how to intervene with the child. Okay, how you can get him interacting, get him alert, aroused. Okay, make him happier. Okay, they will give you more intervention strategies. Okay, so diagnosis of the child is very important. So whenever you require help, go and seek help. Okay, it is always better to approach a professional. The professional will be able to diagnose and find out what are the intervention strategies that you can do with the child. It is not like whatever strategies are being told to you, they will work. But we have to always it is like a trial and error. We have to always try more and more strategies that we can that will be working with our child. So diagnosis important. And we have to do the IQ testing every 5 years. It is not like IQ test is done at at 3 years of age, and later on you shouldn't do. The child is learning, and the intelligence quotient is also developing. So it is very important that you do get it tested every 5 years. Okay, and the when the child is growing, the new sensory issues may come up. Okay, sexual problems when the child is reaching their puberty may come up. So their assessment timely is very important. So I mentioned to you getting help of developmental pediatrician or psychological counselor, behavioral therapist. Okay, therapist. Okay, occupational therapist or physical therapist. Okay, art based therapist. Okay, if there are speech issues, communication issues, you can take help of a speech therapist. It is very important that you approach. Okay, because they are the professionals dealing with children, dealing with the issues. They'll be able to guide you well. Okay, support groups are very important. Okay, if you have a parent group of parents from the children having similar difficulties or similar issues, it will be very easy for you to share. Okay, yes, that I tried, I approached this particular strategy and it helped me. Okay, it is the learning from it. Okay, or you may be able to share whatever you did with your child, or share your personal experiences that may be relieving your mental stress. Okay, or you may call somebody in order to give a seminar lecture together for the parents having children with similar issues. So it is very important that you form a support group of parents. Okay, because your mental health is again important. Okay, you have to give time for your own health, time for your own self and the child. Okay, then group therapy is very very effective. Okay, the children love being with other peers. They learn from other peers. Okay, so when you take a task together, they learn. Okay, waiting. Okay, when they are all doing one activity, they learn patience, being patient to do particular activity. Okay, now it is my turn, next will be her turn. They learn many things when you take a group therapy session. Okay, so group therapy is very effective. Okay, and last but not the least, I would like to mention to you that role of a parent or caregiver is very important, because they play a greatest role in social acceptance. Okay, because these children face many difficulties when they are in uh, learning in a normal regular schooling they are doing. Okay, because the other peers will not be having their intelligence same. They are the ability of these children in grasping some new task will be different, and they will be bullied by other children. So you have to make them understand that this is the problem. This is the child is having problem understanding in anything, and you have to support him. It is your responsibility that you know, help your peer. Okay, you have to talk to the teachers. Okay, you have to make the people who are meeting the child, okay, may take the child in the society. It is again according to the functional level of the child, but you know, getting the child knowing the social helpers. Okay, when you're taking the child to the market, okay, how you behave with the with that particular person, how you behave in that particular public place, the child learns, and they also should know what is the problem with the child, so the child will be integrated in the society well. So it is your role that you teach the child all these things. Okay, communication in the society is very important, and increasing their independence is important, because you will not be always there for them. They have to be independent. Okay, you have to slowly get them doing their own skills. Okay, making them independent in ADLs. Okay, activities of daily living, making them communicate with other people around them. So you have to make them independent, okay, as much as possible ultimately. So I would end up saying that, you know, if we see and experience kindness every day, okay, a child says, if I see and experience kindness every day, it is more likely that kindness becomes a huge part of who I am as I grow. Okay, when you give child love, kindness, then it is love and kindness that you will receive. Okay, if you behave in a right way, in a good way with the child, if you keep your home environment safe, right, then of course you will get the appropriate behavior from the child. Okay, thank you. Dr. Mamta, you can take over now the next session.
Dr. Mamta, you need to unmute yourself.
Yeah. So I'd like to thank Dr. Gauri. I'd like to thank Dr. Gauri. It was very informative, and she explained in a great depth. So now I'd like Dr. Rashmi to take charge of the Q&A session.
Thank you, Dr. Mamta. So, Dr. Gauri, we
Yes.
have a few questions for you. The first one is from Gayatri. She says that her son beats her stomach. And earlier it was very rare, but now he does it very often. She has tried to wrap the bed sheet and keep his hands and hold his hands, and they get very tired doing this. Same way he's boxing his cheeks also. So these
Okay.
two habits are a problem at the moment. And what can be done? What remedies can you suggest?
Okay, first of all, as I said, that you need to know what is the cause of this particular behavior. Okay, now since she mentioned that the frequency of this behavior is increased, you have to find out that why it is happening. Maybe because the child is not able to go out and play what he used to do usually, because of this pandemic situation. We are not able to take our kids for playing. Okay, maybe the child, wants movement, and we have to intervene it by giving another task for him. Okay, which is again meaningful. Okay, so we have to distract him from doing that particular thing. Okay, maybe just note down whenever he does it, because we have to find out the cause for it. Okay, why he is doing it, we need to know. So find out the cause first, and then intervene in right way. Okay, give the child opportunities to explore the environment in the right way. So when he's beating or doing some fidgety movement with the cheeks, probably he's seeking texture. Okay, he's seeking tactile sense from body or environment. So give different types of textures or mediums. Okay, it is the child responds very in a nice way when you give him a body lotion, to the child. Okay, working with mediums is very good. Okay, when just putting the lotion over the body would give a sense of tactile or deep input to the child. The proprioception may be enhanced in a child. So working with mediums is very important. Or even doing water play. Okay, just taking some squeaky or the noisy squeaky toys from out of the water and putting it in. But you have to be very careful that it does not become messy, that you have to direct the child in these particular place. But distract the child from that particular behavioral issue, because the child shouldn't be only in that particular issue, and you will not get a good response in other things if you're trying to make the child learn a new task. So you have to distract the child in a right way. Okay, know what the child like and then intervene accordingly. Use that stimuli to distract the child away from that behavior.
Thank you, Dr. Gauri. Next question is from Snehal Patel. She says many times children cry during therapy and parents are very concerned and don't allow them to continue the therapy. How can you explain to the parents or any strategies?
Yeah, it is very important, right? From the time the parent comes to you with all the difficulties, you have to make the parents understand that the child is not able to regulate themselves in the environment. So whenever we are trying to intervene or give new strategy to the child or give new stimulus to the child, it is very unpredictable how the child would respond. He may just throw a tantrum, he may be crying aggressive. Okay, so you need to make them understand that he would settle down once the input is appropriate, just right. So we have to know that we have to tell the we have to make understand the parents the condition of the child first. Okay, what it is, how the child is responding, how the behavior of the child is. So from that particular completely berserk or disorganized behavior, we have to get him organized. And it is a developmental path. It is not going to be in one day or 1 month or even 3 months. In a short period of time, it is not going to occur. So during this journey, the child may respond very evasively, and so you have to cooperate during the journey. At home also, he may show certain behaviors which were not seen earlier, and you have to give them strategies in order to intervene at that particular movement. So as I said, it is always good to start with calming activities, working with the proprioception. Give the parents strategies that they can do at home. Okay, calming responses. And first of all, make them understand that this is a journey of working with the child. It is not easy to transition a child from completely disorganized behavior into a just right behavior. The child is learning from environment, and we have to allow them to integrate all the senses, and we have to give each input at one time, not giving too much of stimuli. And in this journey, the child may respond in a different way. We cannot predict how the child would behave, but always see that the child is actively participating, and you are not forcing the child. That is when the child goes completely berserk. The child should show interest in the activity. Okay, and he should in turn show a good response, that he is interested in the activity. It shouldn't be like you are just forcing the child, and then you would get a completely behavior which you are not expecting from the child. Okay,
thank you, Dr. Gauri. Next question is sensory processing disorder a condition that can be passed down from generation to generation and can get worse over time?
See, this it is not a familiar disorder that goes on which is hereditary or pass on to generation. The sensory, why it is called a sensory processing disorder? Because the child is not able to process the sensory information rightly from the environment, and it can be because of various causes. The exact cause is not known. Okay, it can be secondary to autism spectrum disorder, or it can be secondary to any condition like cerebral palsy or even a part of Down syndrome, because the child is not able to integrate senses properly, and the processing of the senses is not done, and which does not show a right appropriate behavior that the child should show. So it is not a familial disorder or hereditarily passed from generations, first of all. And secondly, yes, it can get worse with time when after the child grows, because the child is growing and the child is learning a lot from the environment. If you do not intervene the child at the earliest, if you do not understand where the problem lies, and you do not progress with the child in the right way, if you do not give the sensory inputs in the right way, you do not organize the child's behavior, then of course it can get worse. Okay, so of course, if you do not intervene early, you may get worse outcome of it.
Thank you, doctor. Next question. Can diet affect a behavioral problem in a child? If yes, what triggers these issues?
Diet, yes, of course, because it is always seen that when you give foods which are rich in sugar, okay, carbohydrates, it increases energy levels in a child. Okay, so if the child is already hyperactive or over responsive, okay, the child is anxious, restless, always on the go, does not give attention to you, he's easily distractible, then of course that may increase the energy levels in a child. It is also often seen that it disturbs the sleep levels, sleep and activity cycle in a child. Okay, the child may not sleep for many hours. Okay, and you have to give calming inputs to the child in order to sleep. Okay, that is because the sugar level in the diet is too much. Okay, when you cut down the sugar level, the response that is shown by the child as being hyper is of course comes down. And there are some food allergies also which may which have been shown a causative factor to a condition like autism spectrum disorders. Okay, which may ultimately cross blood brain barrier and cause disruption in the functioning of brain. Okay, which may show certain then sensory issues later on. So you have to know what if the child is having particularly lactose intolerance, or there is any other GI related issues like Hirschsprung's disease that Down syndrome kids often have, then that may interfere with their functioning. So diet of course plays an important role, and you have to see that the child may have again preferences, like I mentioned to you. The child may not like slimy substances, the child may like a particular texture of food. Okay, so you have to gradually give input to the child. Okay, you cannot force the child in any way. Whether it is any input, you have to gradually try different textures and see how the child responds to it.
Thank you, doctor. Next question. What is the importance of different color lights that they use for visual sensory stimulation, and how does it work?
Usually visual rehabilitation is very vast field that is developing now. Okay, in order to get the child calm down, always a calming light is used. Okay, the lights are of different frequencies. The red light, infrared, and the blue light, okay, or the ultraviolet rays which have been used are not in a normal bandwidth of the vision. Okay, it is not very dark. Okay, it is not very bright, sorry, that we usually function in. Okay, so when we are working in a dark environment, we first of all we work in a dark environment in order to get the focused attention, because if it is colorful, bright, the child may be distractible. The child may get overstimulated with different visual stimuli at a time. So working in a dark environment is very important. And when the infrared light and the UV light, okay, the blue light or the red light that we use, it is quite intense and focused. Okay, sometimes we use even lasers, okay, to project, which are monochromatic and does not spread much. So it is easier for the child to get focused on a particular picture or the object that you're showing. Okay, also the checkered patterns or black and white concentric circles help the child focus more. So showing all those particular objects in a monochromatic light gets the attention of the child in a better way. So these lights are used because you get focus of the attention, the focused attention of the child in a better way.
Thank you, doctor. Next question is by Mrs. Raji. She says, if a child is not chewing her food properly, but only swallowing it, is it a behavior problem, and how can it be managed?
Okay, when the child is swallowing it, the child is probably first of all is having weakness in the muscles. Okay, probably the child is a low tone child, which is usually seen with these children. Okay, so he or probably is not getting enough information from his the temporomandibular joint. That is why he is not chewing. So you have to teach this particular skill in the child in a step by step manner. So there are chewy tubes that you get. So or if you are teaching the child biting, you can use a material which is firm enough and yet it is soft. So I often use apple, the pieces of apple. So you can wrap it in a soft malmal cloth and keep it at the TM joint, okay, at the molar level, and ask the child to bite, okay, or give a feedback from your TM joint so that the child gets a juicy material. Okay, it is important that the child should like whatever you're giving to him. Okay, so you have to make the child learn that particular skill. Sometimes the child may be also defensive. He does not like chewing, he does not like some certain textures. So you have to give a sensory feedback to the oral system. Okay, giving like a very gentle deep massage, okay, internally to the cheek area from the outside. Okay, and get used to the sensory stimulation around that oral area, and then intervene. Okay, you get many talk tools, okay, or the chewy tubes, okay, the which the child loves biting. Okay, which in that way, when the child likes biting, like the teethers, the child would learn the skill. Okay, so stepwise you have to make the child learn the skill. It is not going to happen at once. So you have to first see what issues are there in the oral system, whether it is musculature which is weak, or the child is defensive to the texture, or the child is does not know at all how to do it. Okay, so when you can slowly introduce the chewing, okay, and make the child learn by using all these tools that are there.
Thank you, doctor. And the next question is, what to do if the child is of 7 years and is reluctant to write?
Okay, so now again, as I said, the cause may be a lot. The child may not be interested to sit in one place. So getting the child sit in one place, you have to engage the child in the right way. Okay, maybe he is seeking a movement. Okay, he may be a vestibular seeking child. He loves going on the go all the time. So right from those sensory system, you have to find out the cause. Okay, channelizing, if he is too energetic, okay, if he's hyper, okay, if he's overly stimulated, you need to engage him in right activities so that he is in a just right level to pay attention to you first of all. Okay, after he wants to pay attention, or you feel he is responding to you, you can use different mediums. Okay, it is lovely responses you get from child when you use mediums, whether it is lotions, or some textured play, like writing in sand, or writing in rice tray, okay, where the dry rice or dry corn or dry pulses are kept, okay, writing in it. or using different types of colors first, just drawing lines. Okay, you have to uh, help the child understand the shapes first, how your fingers moves. There is some particular, when your fingers move, there are different figures or different it leads to different numbers or figures that the child will then understand. Okay, so using different mediums, the child would be alert and giving interest in the activity. Okay, so when you're using colors, or just drawing in therapy putty, or with the play doh you're making, whatever you're trying to teach the child, or just scribbling. Okay, the pre-writing skills you have to first work with, so that you have to engage the child by using all these mediums. That's when the child will show interest. So finding why the child is not doing it, may be like lot of causes. If it is some particular system which is leading the child not sit in place and write, or if the child is not putting pressure enough to get write, draw, because his proprioceptive input is less. Okay, so you have to first know the cause why he is not doing it, and then give particular intervention. So because it is very vague, why, understanding why he is not doing it, you have to get the child interested in that particular activity. And when you use different types of mediums, you get the child engaged, the child shows interest in it.
Thank you, Dr. Gauri, for helping us with our queries. Now over to Dr. Parul for the vote of thanks.
Yeah, hello. Thank you, Dr. Rashmi. Good afternoon, everyone. I'm delighted to get this opportunity to present vote of thanks for today's webinar. Let me express my sincere gratitude to today's speaker, Dr. Gauri Wagh, for sharing her expertise with us and enlightening us with her knowledge. It gave us deep insights into the topic and also revealed some interesting facts. I'm pretty sure the precious knowledge that Dr. Gauri Kamat gave us will definitely help us in dealing with behavioral issues in children with special needs. Thank you, Dr. Gauri. I
Thank you
hereby
so much.
welcome. I hereby acknowledge IAP Central Committee for providing us with this platform and their technical team for the wonderful, consistent tech support. I offer my sincere thanks to IAP Women's Cell Goa team members for working tirelessly in conducting all webinars on a youth scale. I also thank all the attendees for actively participating in this informative webinar. Thank you, everyone. Have a nice day.
So thank you so very much, IP Goa WC, and thank you very much to our today's speaker and all the panelists. It had been really a wonderful session. I'm sure our audience have really enjoyed and learned a lot. I request all the participants to kindly subscribe to IAP YouTube channel, which is by the name of IAP India, and also subscribe IAP Facebook page, which is again by the name of IAP India. So thank you so much. We will continue to bring great and more insightful sessions in future again. Thank you very much.